Thank you very much for being on with us here on Cacoa Tea. So
Yeah.
Jerelle, you're in the UK and you've been in isolation for how long?
7, 8 days.
Wow, wow. So you just started. And how does it feel to be in isolation?
To be honest, it's not that bad as yet. um, I've kind of been like joking around with my friends saying that I've kind of been training for this for a while because I am either at work or at home, so I don't really go out. So it's just a transition from not going to work. And for me, I am fortunate that my work is computational and theoretical, so I can work from anywhere. So I have been lucky in that regard that all I need is my computer and I can still continue working. I do miss the day-to-day interaction with my colleagues and stuff like that because like to send a message is much different than to talk to somebody face to face. But apart from that, it has not been too bad at all. I can't really complain.
How about you, Sophia?
It's not been really bad. Granted, I'm not in isolation, so I get to go to work at least 2 to 3 times a week. Because with my work, I cannot shut it down. And so my son is out of school. It was a bit of a panic, like what am I going to do? And then there was an offer for childcare by our institution. And then my husband was able to has to work from home 4 days out of 5. So it's not been a challenge. I mean, food initially was a shock because the supermarkets there was no food, and I wasn't necessarily prepared initially for the craziness that happened in terms of the hoarding of food from the supermarkets. But otherwise, everything is okay. It's just more of worrying about my colleagues, my family members, friends, people who are susceptible and at high risk for getting ill.
Brandt, you're in Mexico. How is it? How is the
Yeah.
atmosphere like in Mexico dealing with this corona or the COVID-19 pandemic?
Well, the quarantine went into effect on Friday,
Mhm.
but it's not like quarantine like in other countries where you have people being at their home and they are not allowed to leave. Here in Mexico, it's a little more free up. It's a suggestion by the government that people should stay inside, but you could go out, you could walk, you could go to the supermarkets, places are still open. However, me and my wife, we are following the recommendations and we've been inside for a couple of days now. Um, I was a little bored, but because, well, my work is biophysics, I do a lot of work on the computer. So right now I'm writing up a few articles to be published. But the cinemas, they are still open, but I think by tomorrow they're going to be totally closed.
Wow.
So
Wow.
it's not that dire as I've heard in other countries.
Now,
Yeah.
Jerelle, what have you guys been doing, or what did you do in order to prepare yourself to be indoors? Because a lot of folks are probably wondering, oh, what is the social distancing thing, or what is that self isolation? No, I have to go out and buy a bunch of this and buy a bunch. What have you done? And I'm asking you first because I know you're a minimalist, and people probably don't understand. All of your clothes can fit in one suitcase. So that's how much of a minimalist you are. So what have you done in order to prepare yourself for this?
Well, now that you say that, the week that we went into like isolation, we were moving that week from one flat to another flat, and so we were actually eating all our food so that we wouldn't have a lot of food to carry with us. But then we didn't know that we were gonna go, like the country was gonna go into like self-isolation and social distancing as yet. And then the day we moved was on a Saturday, and then we decided to go and get some things to eat, and then you started to see like the shelves were somewhat empty and like things were missing and so on. But we just bought like few essentials that we needed, like to hold us for like a couple of days, and then we say that we would go online, and because we do a lot of grocery shopping online. There's that's the thing here. Like you can like buy your groceries online and get it delivered to you, and it's super convenient. And then when we went online to book a slot, like all of the slots up until like mid-April were gone. So we were like, what is going on? So then you realize that people hoarding food and all that sort of a thing. But you really don't have to hoard food because there is food, and like the people in the supermarket are working hard to make sure that they restock the shelves and so on. So I would tell people not to go crazy and buy a whole bunch of things, because people who are working in the hospitals, people who are still doing this sort of like essential jobs where they can't stay home, they have to have food too, and they have to buy food when they come out from work. So if you eat all the food, the nurses and the doctors that's supposed to be taking care of you, they're gonna faint. Like what? So you have to be considerate of others. So we just buy like stuff that we would normally buy and not go overboard. And our work, the university closed for without knowing when they're gonna open next on Friday, and so we were able to take our computers home with us. So I took my computer home, and me, just like day to day, I've just been like, I like my workspace to be very clean. And you know, like if you at home, like you will clean on a Saturday, but by Wednesday your house will be like a mess, and then you will have to clean on Saturday again. So what I've been doing to keep myself sane is every night before I go to bed, I pick up one or two things and tidy up, so that next morning when I wake up, I can start back working. Because if I wake up and the house is not clean, I will spend like the first half of my day cleaning. So that's sort of a thing, just to keep myself like, you know, level. But yeah, I think people should not panic and go crazy and buy all the food and do all of that kind of a thing, because let's just be considerate of others and that sort of thing. Yeah.
How about you, Brandt?
Well, in Mexico, there's not really panic. Um, in fact, I think the last time I heard it was like just above 270 something cases. Only 10% of these cases were persons who were hospitalized, and there are only 2 deaths so far. In fact, the World Health Organization said that Mexico has been handling the situation very well. We are actually in a phase 1 of the contingency. However, the Mexican government is already acting as if it were a phase 2. So the Mexican government is very prepared, and so there's not much panicking, or there's not heavy restrictions of anything like that. There are a lot of people who live day by day. If they don't sell stuff, or they don't go on the streets, and they don't move about, they're not going to have a salary. So there's still a lot of business going on in Mexico. So this thing about you seeing people rushing to the supermarkets and buying out stuff, no, we've not seen that yet so far. So that's about it here in Mexico. There's not much worriness or chaos so far. But because the World Health Organization said that even though Mexico has been handling things very well, it's going to get worse. so we're not exactly sure what that means, but I think here we are prepared.
I like the fact that you said, the World Health Organization said, because a lot of times people tend to want to take information from everywhere else, but exactly where they need to get the information. How important is it for people to actually consume the information from where they need to get the information, Sopia?
That's
Well, yeah, yes.
That's very important. There are a few resources that I follow and my institution follows, which for sure is the CDC, the Center for Disease Control in the United States. I guess for people in Latin America and the Caribbean, you can follow PAHO. OAS has also information that they're releasing. WHO, obviously, and your local state government websites, Twitter, Instagram. It's important to follow the information that's coming from trusted resources. I would even say over politicians. So you would want to listen to the clinicians and scientists and public health professionals.
You have anything to add, Brandt? Because I know you were going to say something initially.
No. I think people are too caught up in social media, and anything they see on a post or something, they take it as if it was fact. So even watching the local news and and for example national news is not enough, because you have to. Me as someone who is in the science area, even if you see a scientific publication in a prestiged journal, you cannot settle for what they say as fact. You have to compare with many sources, and that's what a lot of people don't do. Even if you're watching the news, don't believe everything you see in the news. Watch various news sources and compare, and try to get the real information. Yeah. So that's what I think people should do. People are just caught up in Facebook and Instagram and whatever they say they believe. So I think that's a problem.
Any final words for Jerelle? Do you feel like this is going to get worse, or do you fear it will get worse?
Well, you introduced me as doc, but I'm not a medical doctor. I'm not a professional, and I'm just like a normal citizen listening to the news and listening to what everyone is saying in terms of, as Sopia was just saying, the official websites are publishing, and as they predict that it will get worse before it gets better. But I think that if I were to say something like last words would be, I think that people should really put, and I think Miss Ahmed mentioned that earlier, that people should really put others before themselves and think that, like, okay, I might get it and I might get better, but I might give it to somebody else that will not get better. Because for me, the first thing when I hear lockdown, I say, boy, let me buy my ticket and go up my mother home. I know and I in the country. But when the next morning I sleep on it, and when I wake up next morning, I think about it, by the time we would have left, like, the cases were already rising, and just the fear of contracting it and bringing it to the Caribbean that had relatively no cases as yet. And I think about my in-laws and my grandparents and everyone who are older, and to bring that to them, I was just so fearful. But I said, let me stay where I am. I don't want to infect nobody. But like, if you have the option to stay put where you are and self-isolate, do that. Listen to what the officials are telling you, and just put others before yourself. Like, and the thing about it is that this is a new virus, and nobody really understands it well. And so you don't know, like, people might get it and they might get better, but then 10 years down the line, they might come up with all kind of respiratory deficiencies, impairment, because they had the virus. So you don't know what the trajectory of this illness is going to be like. Like, if you read about like polio epidemic, there were persons who didn't really have symptoms for when polio pandemic was going on, and then years later they had all kind of joint pains and stuff like that stemmed from the disease. So we do not understand the illness. So the best thing to do is to listen to the officials, and to, if you can stay home and work from home, because that will help minimize the spread, and stop buying all the food, because then doctors will faint. Okay.
She sounds like she's so annoyed. Stop buying all the food. It's so annoying. I don't even understand that. Why people are going crazy.
And toilet paper.
I don't. I got, when I first saw everybody buying out the toilet paper, I was like, why toilet paper? Is it because I'm West Indian? Like, I don't understand the toilet paper thing.
The toilet paper, I don't know.
Like, what is going on with all the toilet paper? I'm like, don't they know how to like use water, like soap and water? You know, after you use the bathroom, you go and take a shower. You know, I couldn't understand that. Sophia, any final words? Any words of encouragement?
Yeah, so people are anxious. People are worried about themselves, worried about what if it really is a total shutdown and no one can leave their homes or communicate with their loved ones. There's what if there's no access to food because the pipeline might shut down. Um, so I want to acknowledge that because as I said, I am, worried about my family members who are at risk and friends and my colleagues who are seeing patients and getting sick. So I would say to listen to your officials, practice social distancing, and what that means is essentially don't go out if you don't have to. So there are people who need to go out, and the others who don't. If you're in a place where you can walk around your house, go outside, stretch, practice yoga, just do jumping jacks, anything to stay active. Try to ensure that you eat fresh vegetables and fruits, so at least frozen vegetables, if you can, so that you're not, there are memes going around where people are showing 10, 20 pound gain, because there's nothing else to do but watch TV and eat. It's an opportunity to write, to be creative if you can, if you are. And yeah, and to take care of each other and not be, as Jerelle was saying, not be greedy, to not be so selfish, to think about others who need the resources, like hand soap, like alcohol, like the masks and the gloves that are also being hoarded and have been hoarded by lots of people who do not need them. And if you stay home, you won't need it. So wash your hands, cough into tissue paper, wash your hands, and look for any signs of illness. And if you're not very ill, stay home. Only let the very, very ill go to the hospital because the resources are very strained.
How about you, Brandt? Any words of advice?
Yes, not really words of advice. I just want to give some information. I don't want to startle anybody, and I'm not a psychologist, so I don't know how to give to people the right way so that they could be calm. Me as a scientist in that field, I can only tell people that this pandemic is just one of, it's maybe like the first of many to come. We're living in a new society, we're living in a new world, and we have to realize that we humans on the earth, we are a plague. We are a plague, and nature always finds a way to balance off and fix things. So the pandemics have been around for many hundreds of years, thousands of years. Viruses have been here before people were on the earth. In my laboratory, we are not even worried about the viruses. The viruses is the least part of our worries. Right now, it's coronavirus is something that's right now that's in. But for example, in my laboratory, we work with superbugs, and the superbugs are multi-resistant bacteria that are already here, and there is no drug that can kill them. That's what we're working on in the laboratory. So um, I hope that the world recovers from this pandemic quickly. But trust me, this is going to be something that's going to be occurring more frequently in the future. So people don't have to be only prepared for now. You have to be prepared for the future. In maybe a 2 3 years, maybe 5 years, maybe 10 years, these things are going to continue and they're going to become more frequent. So I don't know how I could tell that to people so that they would be more calm, but it's better to know the truth than to know a comfortable life. That's my final comment.
Guys, thank you very much for coming on with me here on Cacoa Tea and sharing. I really do appreciate you guys are in all different areas of the world, and you've taken time out to come in and talk to us, and we appreciate the advice. I hope that a few people have taken or have listened to some of the advice that you guys have been giving out, especially those of you who've been in isolation, who understand what the isolation is, who have to understand what social distancing is, even in our communities where it's very hard because we're very sociable people. It's very hard to social distance ourselves from people. So I really appreciate you guys coming on here with me. We're gonna make room for more because we're gonna be connecting. Thank you guys.